This video is for basic facial, and we are going to start this video as we would upon arriving to work. So first thing we do when we get to work is we wash our hands. We go to the sink, we wet our hands, we get a coin-sized amount of liquid hand soap, and we wash our hands together down to the wrist. We wash the back of our hands down to the wrist. We wash our fingers, and we wash the back of our fingers. We wash our fingertips and nails. We wash between the fingers and the thumbs. We wash the thumbs, and we wash the wrist, and we do all of that washing, interlocking motion for a minimum of 20 to 30 seconds. And then when we feel like we've gotten really clean, we will rinse thoroughly underneath the sink. Once you've done that proper rinse, you'll grab either disposable paper towels or a towel, turn the faucet off, completely dry your hands, and then if you use paper towels, you'll throw them in the trash. If you use a towel, you'll throw it in a closed container until time for laundry, and then you'll grab your hand sanitizer, which is 70% ethyl alcohol, and you will sanitize your hands. And once you've done that, you can then go and prepare your space for your client. Of course, we are always trying to be our most professional and prompt, being respectful of their schedule and your schedule. So we are going to make sure that we're on time, and we're going to do everything that we possibly can prior to the client's arrival. And that means having the facial room ready. So what we're going to do for that is we're going to disinfect our workstation, bed, and equipment using a disinfectant wipe, and of course following manufacturer's instructions. We're going to check equipment to ensure all devices are in safe working order and plugged into a working receptacle. We're going to gather clean supplies needed for the facial service, storing in a clean, closed container. We're going to turn on the hot cabbie and stock with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. We will fill the clean steamer glass with distilled water and preheat the steamer. We're going to dispense products needed for the service according to skin type and client's needs as follows. We will prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or we remove product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup tray on the tray. We're going to drape the facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel along with a rolled towel to support the head and neck of the client. Save the third towel to lay across the client's décolleté. So we're going to get all that done, and we've done a bunch of stuff that we're going to go ahead and show you we've done. We've got our tray here, and we're going to review what we have on our tray. Now, obviously, if it's a first-time client and you don't know the skin type, you can just, as it says, you can prepare everything and have it out. You just don't have it portioned out. And once again, you're going to want to do that, of course, ahead of time. So we have 4x4s, 2 squares, and we have cotton rounds. We have cleanser. We have exfoliant. We have massage product. We have a mask. We have eye cream and moisturizer. We have water. We have makeup remover. We have astringent. We have those single-use spatulas that we can dispose of as we use them. We have wooden stick Q-tips and gloves in case we need to perform extraction. So we have all of our trays set up and ready to go. Just realized there's one thing that I need to get out. We have toner, which we have a spray toner for that. One second, one thing for my tray. Okay, so now we are in a good place to meet and greet with our client for our client consultation. Now, I am going to be washing my hands again before I begin the service, but just a note that I would never approach a client unless I have clean hands. So I've washed my hands, imagine, prior to greeting the client. So I'm now going to go meet my client and do a client consultation. And I'm going to give it a nice overview, but there are some really important parts of this. So you really want to be thorough in this and take some time to really get these questions answered thoroughly. And if you have any questions, we'll look it up, find the answers. But you would greet the client and escort them to your work area, and you would determine the client's preferences and assess the client's needs. You would assess the client's skin by performing a skin analysis, at this time with your eyes obviously, to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We will assess the client's consultation form for any medications and products used within the last 72 hours. You're going to consult with your client on any known allergies. Of course, that's critical. You never want to use a product that has an ingredient in it that your client may potentially be allergic to. And you're also going to make sure that you've ruled out certain ingredients that they've used within the last 72 hours that could then cause problems with anything that you do with the skin. You'll consult with the client on any facial surgeries within the last 3 months and if the client is under a physician's care. You'll assess if the client is prone to cold sores or fever blisters, and obviously if there's any kind of active lesion, herpes lesion anywhere, you would never perform the service, not even a question, super highly contagious, not going to happen. You'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. You'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If you have any of those contraindications whatsoever present, you would not be performing the service. Luckily for us, our client does not have any of those. So there's lots of more detail that we can go into here. Once they have filled out the client consultation form, you probably want to take them to a more private area, and then you can get the details of that. So maybe you take them to a quiet area where you can ask some more thorough questions, but you need to make sure that there's no contraindications before you start working. And like I said, we're lucky our mannequin here has no contraindications, so we can proceed with the service. So what we would do is, of course, escort that client into the facial room. If you're not already in there, you'll have everything laid out, draped, etc., and you're going to give them privacy. So you'll leave and close the door, and they're going to change so that they can just rub waist up. And then they can climb into the facial bed. And then when you knock on the door and they've given you permission to come back in, you can come back in and then continue that comfort piece. So I'm going to get them set up and more comfortable. And then, of course, we will wash our hands to begin the service. So we've got a roll towel here we're going to put under the neck for additional comfort. And we want to make sure that she's nice and warm and cozy. And so we're going to add just an extra towel across the décolleté, like additional drape here. We've got a headband, so we're going to take and make sure that we can pull her hair off of her face, out of the way of the face. And if you have a hairnet, etc., whatever, one of those, just keep it out of the face. And then it would be time for you to go ahead and wash your hands so that you could get started performing the service. So you would go back to the sink, you'd wet the hands, you'd get that coin-sized amount of liquid hand soap, and you'd go ahead and wash your hands down to the wrist. Then you'd wash the back of the hands down to the wrist, you would wash the fingers, and you would wash the back of the fingers. You'd wash the fingertips and nails, you'd wash between the fingers and the thumbs, you'd wash the thumbs, and you'd wash the wrists. And you would do all of that interlocking wash for a minimum of 20 to 30 seconds. And then when you feel like you've done a really good, thorough, proper wash, you can rinse everything off under the water, find either disposable paper towels or a towel. You're going to grab the towel, turn off the faucet. If it's paper towels, dry the hands and throw it in the trash. If it's a towel, you've dried the hands and you can put it in a closed container until time to do the laundry. And then you're going to get that hand sanitizer and you are going to sanitize your hands thoroughly. And at this point, you're fresh and clean, client is comfortable, you can go ahead and start the service. And then, of course, you're educating her throughout the steps of the facial. And the first thing that we do, of course, is we remove makeup. So we're just going to grab a little bit of makeup remover and take care of that step. Then we're going to do the initial cleanse of the face, which is really just probably going to remove a little bit of the makeup, the dirt, the debris. So you're going to get your cleanser and you're going to come in and you're going to remove the makeup and give her that first good cleanse of the face. Once you're done with that first cleanse, you can remove it. And then you would go ahead and cover your client's eyes, because what you're going to do at this point is you're going to bring in a magnifying lamp or a Woods lamp, and you would tell your client that you are getting ready to do your professional skin analysis. You don't have to use those words, but that you're bringing in a bright light. And this is where you're going to bring the lamp. I don't have one, and turn it on. And you're going to take some time here to really, really assess the skin. You want to be looking for so many different things. Maybe it is what you've had a conversation about. Maybe she really wants you to look for any kind of breakout, or she's feeling like there's a lot of excess oil, that she's really struggling with acne, and you really want to see what it looks like and what's going on. So you're looking at the chin, you're looking at the pore size on the cheek, you're doing all different things. Maybe she's telling you that she's dehydrated, or maybe she says that she's flaky or feeling like she's showing some signs of aging. She doesn't like the fine lines around her eyes, etc., etc. We could go on and on. So this is where you're going to take the time to really thoroughly investigate different parts of the face, neck, etc., to give it a really good professional analysis. Not only because you want to be able to help her with her treatment and services with you, but you're going to be able to then extend to recommendations with home care, like her home care regimen, that's so critical to support what you're doing at time of service, and also for her to maximize her results. And then also for your plan going forward of suggestions of treatments that you know would be a benefit based on what her skin conditions are, and knowing what her skin goals are, what you've been working on together. It could be things like hyperpigmentation, and at the same point, if this is a new client, or even if it's not, you're always doing that check of everything on her skin that you get to see through the magnifying lamp or the Woods lamp. So you're going to always record, whether you're using a software system or a client card, you're going to record the treatments, you're going to record the products used, but you're going to record what is happening on the skin. Where does she have freckles? Where does she have moles? Have they changed at all? Are they exactly the same? What improvements do you see? Or what improvements would you like to see if it's a first-time client? So this is where you're really going to take the time to go through all of that view, so that you know when you have a minute after the service and you're writing down all your documentation, that you have a really good gauge on where your client's skin is and what's on your client's skin, so that if anything changes because you are their skincare professional, you potentially could notice something before they could, and then you could also make a recommendation or suggest a visit to the physician if something's changed with like a mole or etc. So it's something out of your scope of practice. So that's what you're doing at this skin analysis step. So now you're done with that. You're going to turn off the light, bright light, and you're going to take it out of the way, and then you can remove the cotton rounds, and then you can continue. So now you're going to go in with the second cleanse. And so if you saw anything remaining, or this is a time, if she's someone who uses a lot of product, this is the time to really get in there and continue that cleanse step. So second cleanse. And now I'm going to remove that second cleanse. And then you would go in for your third cleanse if needed. So I'm going to assume that she needs it, but if you don't need it, just an FYI, we're going to go ahead and do our third cleanse. And whenever you're using your products, we're always avoiding the eyes, the nose, and the mouth. We work around them. And then we can wipe off this third cleanse. And after this third cleanse, we are going to tone. So just a note here, I'm going to be using a spray toner, and I'm not going to let my nozzle come into contact with the sprayer. And then after we have done our toner, we are going to now move forward with exfoliation. So what I'm going to do is I'm going to take about a pea-sized amount of an exfoliant. And of course, you're always going to read and follow your manufacturer's instructions with all your products. I'm just going to spread it out a little bit on the face, and then I'm going to massage it in for 1 to 2 minutes. So just based on what your manufacturer's instructions are, that's what you're going to do. And of course, like everything else, I'm avoiding the eyes, the nose, and the mouth. once you have it all massaged in, we're going to review the next step. So I don't have some of the equipment here, but I'm going to read you what happens at this point with the exfoliation. So you would retrieve the steamer and turn it on. Position the steamer next to the facial bed. Make sure that it is facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, position the steamer about 16 inches over the client's face and aim it at the client's chin for even distribution on the face. Allow the unit to function for 3 to 5 minutes. Remove the steamer from the client's face. Return the steamer to its previous location for disinfection. So basically what we talked about setting up before the client got there, that we were preheating and putting distilled water in. You're going to go get the steamer, bring it over to the facial bed, turn it on, make sure that it's facing away from the client so that it can get its little steam going. Once that steam is going, we're just going to turn it, position it over the client's head, aimed at the chin, whichever way it's closest and facing, about 16 inches, and then you're going to let that mist come down over the client for 3 to 5 minutes. But because we're doing a video, we are going to pretend like that time is elapsed. I also don't have the equipment. So we're going to turn the steamer away because the time has passed. You're going to go ahead and turn it off and then take it, return it to where you got it from, and you'll disinfect it after the service. And then you can remove the exfoliant. And I also don't have a hot cabbie, so what I'm going to do is grab a towel and pretend like I'm getting it out of my hot cabbie, always testing the temperature on my wrist, and I'm also going to check the temperature on my client's collarbone. She says it's fine. So I'm going to lay it on the face, and I'm going to put it on the face, but I'm going to leave the nose out so that she can breathe and apply a little gentle pressure. So you will feel the rag cool down within about 20 to 30 seconds. So just leave it on there for a little bit of time, not long. And then you can remove the exfoliant that way. As you feel your towel start to cool down, you can go ahead and remove the exfoliant. And then you'll want to make sure your hands are nice and dry, because if your client needs extraction, that's when you're going to do it. So we're going to have to put gloves on, because you always have to wear gloves for extraction. And if you need to use your light, you'll also need to cover up the client's eyes. So because we don't have a light, we're not going to use it, but this would be when you would cover up your client's eyes again, and you'll tell them that you're going to be doing extractions, and let them know, check in on their comfort level. You're always checking in on their comfort level. So there's a couple of ways that you can do extractions. You can soak your cotton rounds in astringent, and you can place them on the fingers and do your extractions and kind of work around the cotton rounds and then throw them away. I'm actually going to be using wood stick Q-tips, which means for every extraction, they go in the trash. So 2 of these little guys are partners, and then they go in the trash. So I am going to soak in astringent, and thankfully she does not have a lot of that needs to be extracted. So just note that if the magnifying light or lamp is on, you're going to have her eyes covered, or his eyes covered, and then you can go in and perform extraction. So she just has a couple that we need to get rid of on the chin. So now I'm going to throw these away, and I'm getting 2 brand new ones, and I'm going to soak those in astringent. So each time they're just getting thrown in the trash. And she's got 1 more, that's it. Throw it in the trash. So then, of course, you're going to want to remove these gloves and throw them away as well, these disposable gloves. and we will toner. So once again, I'm not going to touch the 2x2s with the spray nozzle. I'm going to make sure to keep that far enough away. And I'll go in and tone. And you never want to perform extractions longer than 5 to 7 minutes, just being very conscientious of the client's discomfort or comfort level. You want to get in there and you want to get it done. And the good news is that after you've toned, you get to do the massage portion of the basic facial, which after extraction is probably a welcome relaxation moment. I will note that if someone has severe acne, what's like stage 4, you would not be, pardon me, doing massage at all, or very limited, because you don't want to spread any bacteria or cause any harm. So when you do get ready for your massage, one thing that you want to note is you do want to make sure that you get enough massage product on your hands prior to starting your massage, because you don't want to have to leave the client off and on to go back to get more massage product, because you really want your client to be able to relax. So just making sure when you start out that you have what you need so that you can just be fluid with your massage, and then be the client can actually be relaxed, and you can just be fluid and consistent. bug. So then you will be removing the massage product. And then after that, we're going to apply a mask. And let me just grab a brush. So I'm going to apply my mask with a brush. And once again, of course, avoiding the eyes, the nose, and the mouth. And of course, we would always be reading and following manufacturer's instructions for the product. And, you know, base it, of course, off the client's skin type and sensitivity and all of that. So let's say for all intensive purposes that this mask was supposed to be applied anywhere from 5 to 10 minutes based on the client and the client's skin. And so because we're doing a video, we are not going to sit here for 5 to 10 minutes. So we are going to assume that the 5 to 10 minutes have passed. So let's remove the mask. we will tone. So one final tone after the mask comes off. Once again, we will not have the sprayer touch the 2 squares. And then we will apply skincare, final skincare. So serum possibly. I'm going to apply an eye cream and a moisturizer. Of course, I'm going to use just a teensy bit of eye cream on the ring finger, and I'm going to apply it because it's gentlest finger on the zygomatic arch and the brow bone. And then because it is nighttime, I'm going to go ahead and put on her nighttime moisturizer. We already discussed prior to this step her daytime routine with sunscreen, etc. And she'd already mentioned a couple things she was going to go home with. So we're just going to confirm those few things for sure that we know she wants. And then as we've walked her through the rest of these steps, we probably have a few more things to support at home that we can go over. So we're going to go just finishing up here. And then of course we're going to apply a little product to the lip, because who does not want to leave with a gorgeous hydrated lip? Everybody does. Her skin feels amazing, and so we'll present the skin to her with a mirror, show her how great she looks, and then we'll take off the extra things and allow her to have some privacy to change, and then meet us out in that client consultation area. And it's at that point that we would review any maintenance, aftercare, and also review her at-home regimen to make sure she has, we've pulled what she needs to get to take home today to purchase, so that she can obviously get the best results from her service. And we are going to go ahead and take her to get her checked out. We are going to get her rebooked for her next service, because we also discussed as we were working through the facial what we saw and what we would recommend to really get her skin its healthiest and meet her skincare goals. So we've got her rebooked, we've got her products rung up, she's on her way, and we've got another facial appointment coming in. So we have got to get back to our room and clean it up. So the first thing you're going to do when you get to your room is you're going to find any single-use items that you haven't thrown away, and you're going to discard them. Any implements that you've used, you're going to put in a closed container labeled to be disinfected. You're going to take all of the linens and the towels and everything that you used and put it in a closed container until it's time to do laundry. And then you're going to identify a cleansing agent. You're going to read and follow manufacturer's directions on that so that you can mix and get it ready for usage. Wipe down the workstation with that cleaning solution to remove any debris. Once you've done that, you're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting. You will have to put on disposable gloves for that, so go ahead and put your gloves on, and then you can follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You will disinfect electrical equipment, store it in a clean area separate from other implements, which would be your steamer, etc. Then you'll take those gloves off, throw them in the trash, and you need to do your final hand wash. So get to the sink and you'll wash your hands, wet them, get a coin-sized amount of liquid hand soap, and you're going to wash your hands down to your wrist. You're going to wash the back of the hands down to the wrist. You're going to wash your fingers, and you're going to wash the backs of your fingers. You're going to wash those fingertips and nails. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your thumbs. You are going to wash your wrists. You're going to do all of that interlocking washing for a minimum of 20 to 30 seconds. Once you have done that, you can give it a thorough rinse under the water. When you feel like you've gotten that proper rinse off, grab disposable paper towels or a towel, turn the faucet off, dry your hands off with a towel. If it's paper towels, throw it in the trash. If it's a regular towel, it's now dirty and it needs to go in that closed container with the other dirty laundry until time to do the laundry. And then you're going to grab that hand sanitizer, 70% ethyl alcohol, and you will finish your hand wash with your hand sanitizer, doing all the same things. Then and only then can you go ahead and get ready for your next client. You can start to remake the bed and all of the things that you need to do to prepare for another client. So that concludes your basic facial video.